Hello dear students, I am Associate Professor of Department of Human Anatomy and Medical Terminology of Azerbaijan Medical University, Dosent Abdullayev, and today we have the new lecture on the subject of topographic anatomy, and the topic of our today's lecture is topographic anatomy of the neck, anatomical foundations of incisions which are performed for detection of organs, vessels, and the nerves of the neck, topography of the soft tissues of the neck, triangles of the neck, their topography, contents, and clinical anatomy, topographic anatomy of the nuchal area. As always, I have prepared the plan for simplification of my explanation. Firstly, I'm going to explain the topographic anatomy of the neck, general information about it. The second part of our lecture will devote to incisions which are performed for detection of organs, vessels, and the nerves of the neck, topography of the soft tissues of the neck, and triangles of the neck, their topographic, and topographic anatomy of the nuchal area, the fourth part of our today's lecture. As you know, the neck or the cervical region, cervical area of the human body doesn't have the great size, but it contains the very important blood vessels which supply the head and neck, the structures of the head, like the brain, sensory organs, the apparatus of mastication, and so on. Also, the cervical part of the spinal cord locates in the vertebral canal, which corresponds to this area. Despite of this small size, the neck area has the great importance in theoretical and especially clinical practice, especially in the surgery. And this region is limited superiorly by the line which pass through the mental protuberance to the external occipital protuberance, this line, and the inferior border of this region, the line which connects the jugular notch anteriorly and the spinous process of the seventh cervical vertebra posteriorly. This line passes through the sternoclavicular joint along the both clavicles till the acromion process of the scapula and turns posteriorly and reaches to the spinous process of the seventh cervical vertebra. And you have to know that this area, neck area anteriorly, by the sternocleidomastoid muscle is divided into the two triangles, the anterior or medial triangle and the posterior or the lateral triangle. The sternocleidomastoid muscle, a very important anatomical landmark, and it has the two heads, the medial head which originate from the sternum and the lateral head which originate from the sternal end of the clavicle. Then these two heads connect to each other and they attach this muscle attached to the mastoid process of the temporal bone. This is the posterior view on the cervical region. You have listened from your anatomical classes that the posterior region of the neck, it doesn't consider it like the part of the cervical region because the due erect position, erect standing of the human body, the back muscles, they very good develop, and the back muscles they occupy the posterior part of the neck, and we have studied the muscles on the posterior part of the neck in the topic of the back muscles. But from topographic anatomy of the view, it's also part of the neck, and the nuchal area, which is located between the external occipital protuberance, and the line then passed along the right and left superior nuchal lines. It's the superior limitation of the nuchal area, and posteriorly, as I have noted, this line passes through the 7th cervical vertebra and reach to the acromion process of the scapula. Here's the regions of the neck, or the areas of the neck. You are looking at the carotid triangle, which I'll explain slightly later. Submandibular triangle with the very important glands and the two very important vessels, the facial artery with the facial vein. Submental triangle, which is located under the mental protuberance, and this region also consists of the very important internal organs, like the main part of the pharynx is located here, also the larynx with its blood vessels, nerve structures, and the voice apparatus are also located in this area. And these sections of the neck, dissection lines of the neck, they must be very delicate, because the skin of this area is not so thick. It's thinner than the other areas of the human body. Dissection lines first line passes through the mental protuberance vertically till the midpoint of the jugular notch of the sternum. By this line, we can separate the neck into the two equal halves. And please look at the position of several very important landmarks, like the hyoid bone, this one, then the thyroid cartilage, which is very prominent, and it's very prominent in males, and especially in the thin persons. Next line for this section must be provided parallel to the superior border of both clavicles, this dark blue line. And you are looking at the projection of several internal organs, like the larynx, a thyroid gland. And in this picture, you can observe the very important anatomical landmarks, or the projections onto the surface of the skin, like the prominentia laryngea, laryngeal prominence, and the beginning part starting of the sternocleidomastoid muscle, thickness, which is formed by the sternocleidomastoid muscle, and the relation, the important the landmarks and internal organs to the cervical vertebrae, like the hyoid bone, which is located at the level of the third cervical vertebra, and the thyroid cartilage at the level of the fourth, and the inferior part of this cartilage also corresponds to the fifth cervical vertebra. The location of the isthmus of thyroid gland, which corresponds to maybe to distance between the second and third, and maybe between the third and fourth cervical vertebrae. And in this picture, you are looking at these very prominent structures, the anterior and the posterior triangles of the neck. As I have noted, these two triangles are separated by the sternocleidomastoid muscle. The first number first indicates the thyroid notch with the thyrohyoid ligament here between the hyoid bone and the thyroid cartilage. There is the membrana thyroidea, thyrohyoid membrane, which is the pierce by the superior laryngeal nerve from the as a branch of the vagus nerve, and the superior laryngeal artery, which is branch of the superior thyroid artery from the external carotid artery. And the laryngeal prominence, which I have explained before, which is very prominent in males. In females, this landmark cannot be observed because the angle which is formed between the two plates of the thyroid cartilage form the angulus more than in males. And the median cricothyroid ligament between the cricoid cartilage and the thyroid cartilage. The cricoid cartilage, which is the base of the larynx, also is projected by the midline of the neck. Isthmus of the thyroid gland, which connects two lobes of the thyroid gland. It corresponds to the second to third, maybe third to fourth cervical vertebrae. And you must know that in the 35% of the cases, the third lobe of the thyroid gland, the pyramidal lobe, can begin from this isthmus. You can find here in 35% of the cases the pyramidal lobe. The greater supraclavicular fossa, the posterior triangle, you can palpate in this region the first rib in this fossa, and very easy way for palpation of the clavicle when the muscles of this region are relaxed, and the shoulder girdle is close to the midline, to the vertebral column. In this position, the doctor can palpate the first rib above than the clavicle in the supraclavicular fossa. The 7 explains the sternal head of the sternocleidomastoid muscle and the projection of the common carotid artery. A very important artery, as you know from the course of the angiology. The left common carotid artery begins from the aortic arch. Right one begins from the brachiocephalic tract. It means their origination is different, but you as a future surgeons must know the projection of these two common carotid arteries in the right side and in the left side. I mean in the both sides, the superior part of this artery is projected by the midpoint of line which connects the angulus mandibulae with the tip of the mastoid process. But inferior part of this artery at the left side, it is projected onto the point which is located between the two heads of the sternocleidomastoid muscle. I mean the medial and the lateral heads. But right common carotid artery, its beginning point is corresponded to the sternoclavicular joint, to the right sternoclavicular joint. And between these two heads, the medial and the lateral heads of the sternocleidomastoid muscle, is located the lesser supraclavicular fossa, overlying the internal jugular vein. This fossa supraclavicularis minor, is visible in very thin persons. But then the persons which the more or less develop the fatty tissue, this fossa is invisible, and especially it is closed, it is projected onto this fossa, the internal jugular vein, main venous collector of the head and the neck. It means the internal jugular vein drains the venous blood of the head and the neck inferiorly with the subclavian vein. These two veins, internal jugular vein and the subclavian vein, they form together, they form the brachiocephalic veins, and by junction of two brachiocephalic veins, the superior vena cava superior is formed. Hence, explains the lateral head or the clavicular head of the sternocleidomastoid muscle. Look at the course of the brachial plexus, which is palpable onto the supraclavicular region. You can palpate the very dense tissue, dense connective, but it's not actually, it is not the connective tissue, it is a nervous tissue, but you can palpate the main trunks of the brachial plexus in this region. And 12 explains the way course of beginning part of the subclavian artery. Initial part of this artery is located in the interscalene space, spatium interscalenium, which is formed between the anterior and the middle scalene muscles of the neck, because this space is called the spatium interscalenum. I will give you the information about this space slightly later. And the trapezius muscle, which separates the anterior part of the neck from its posterior part. And again, the topographic anatomy of the cervical region, definition of this region, you are looking at the main muscles of this region. You are looking at the jugular notch. This is the jugular notch, and the two heads of the sternocleidomastoid muscle, the sternal head or the medial head, and the clavicular head or the lateral head, and between them the fossa supraclavicularis minor, this one. Mainly it is filled by the fat tissue, and it is the picture is this person is not so seen, a very athletic man, and the less fat tissue in these persons in athletic configuration of the body give us the possibility for good explanation and for good understanding of this fossa. And here's the inferior belly of the omohyoid muscle, which is crossed by the sternocleidomastoid muscle. Of course, it's the inferior part, inferior belly of the omohyoid muscle, and the trapezius muscle again, which separates the anterior region from the posterior region of the neck, the clavicle, and the external jugular vein, which is located more superficially than the internal jugular vein, and especially it's very prominent, it's very pronounced during coughing. It can be enlarged in size, and submandibular gland, which is located in the triangle of the same name, and the projection of the thyroid cartilage is the mental protuberance, where the line, imaginary line for separation of the head from the neck begins. And in this picture you can observe the two planes, the inferior plane, horizontal plane, and the superior plane. Also, you have to know the another plane for separation of two surfaces of two walls of the neck. It can be used. It's of course the imaginary plane, which pass in the frontal way. By the frontal style, it passes through the transverse processes of the cervical vertebrae, and by this, the frontal plane, the anterior portion of the neck, can be separated from its posterior portion. And using of the plane like this frontal plane also it has the very important causes, because the cervical fascia, especially the proper fascia of the neck and the deeper layer of the cervical fascia, prevertebral layer of the cervical fascia, they attach to transverse processes of the cervical vertebrae. You are looking at the bony structures of the neck. You know the bony foundation of the neck is performed by the 7 cervical vertebrae. These vertebrae are smallest, and they are connected by the interrupted and the contiguous joints, interrupted joints like the zygoapophyseal joint or the articulatio processus articularum, articulations of the articular processes. Here's the transverse processes of the cervical vertebrae, and I've explained before that these transverse processes, they have the great importance, and the transverse processes of the cervical vertebrae, actually they are visit cards of these vertebrae, because the only transverse processes of the cervical vertebrae have the foramina openings on it, and the foramina processes transversarium, they are called, together from up to down, or if you want from the down to up, they form the canalis, which contains the vertebral artery, and the two main arteries, they supply our brain, our cerebrum. It's the internal carotid artery, which it isn't protected in the cervical region. It is located less or more superficially, but the vertebral artery, it is located within the canal. This canal is formed by the junction of all foramina of the cervical vertebrae, and between the cervical vertebrae, between their bodies, you are looking at the discs. These discs are thinner than the, for example, lumbar portion of the vertebral column, and you have to know that it is the atlas, the first cervical vertebra without body. It is considered like the bony disc between the head, between the skeleton of the head, of course, the skull, and the second cervical vertebra. This is the main function of the neck. Neck connects the head and the trunk. It's like the bridge between the head and trunk. And if you are looking at the muscular part, why the muscular? Because under the skin of the neck, you can find the muscle which has the same structure, and it's very important, the same origination with the mimic muscles. It's our platysma or subcutaneous muscle. It is located just under the skin, and it looks like the mimic muscles that, and it originates at the level of the second rib from the fascia, and goes superiorly and medially. Now this muscle has the great importance due to the development of the cosmetic surgery, plastic surgery. It helps to blood flow in the superficial veins of the neck, and superiorly the bundles, the fascicles of this muscle are attached to the mesenteric fascia and to the muscular portion of the depressor labii inferioris muscle. This is the sternocleidomastoid muscle. It's the main landmark which separates the anterior or medial portion of the neck from the lateral of the posterior portion of the neck. The scalenus and the sternocleidomastoid act together in several muscular actions, such as the lateral neck flexion. The sternocleidomastoid and the anterior scalena act together in the neck flexion. About the fascia of the neck, before explanation of the fascia of the neck, I want to talk about the muscles of this region. As you know from the course of the human anatomy, the muscles of the neck are divided into the superficial and the deep groups. Superficial muscles like the sternocleidomastoid muscle and the platysma, and the next group in the some anatomical textbooks, these muscles are explained like the middle layer of the cervical region, the suprahyoid and infrahyoid muscles of the neck, and finally the deep muscles of the neck, the lateral group. Lateral group is performed by the anterior, middle, and the posterior scalene muscles, and the medial group, longus colli, longus capitis muscles, and two little muscles like the musculus rectus capitis anterior and the musculus rectus capitis lateralis. The last two muscles are located between the atlas, I mean the first cervical vertebra, and the occipital bone. About the fascia of the neck, superficial fascia and its pretracheal layer, the muscular portion encloses the infrahyoid muscles, while the visceral portion surrounds the internal organs, the thyroid gland, the larynx, trachea, pharynx, and esophagus. And the prevertebral layer surrounds the cervical part of the vertebral column and the muscles associated with it. Fascia, the cervical fascia, form the special vagina, carotid shed. It encloses the common carotid artery, internal jugular vein, and the vagus nerve. The visceral fascia also encloses the larynx, trachea, pharynx, esophagus, and the thyroid gland. You are looking at the muscles of this region. It's the hyoid bone with the suprahyoid and the infrahyoid muscles. Suprahyoid muscle group is the digastricus muscle or the biventer. Mylohyoid muscle, which forms the oral diaphragm. Stylohyoid muscle, this one, and the genohyoid muscle. These four paired muscles form the suprahyoid group of cervical muscles. And the infrahyoid group, the muscles as the omohyoid, sternohyoid, sternothyroid, and the thyroid muscles are located in this region. And the Sternocleidomastoid muscle, it doesn't belong to suprahyoid and or infrahyoid muscle because it occupies these two regions at the same time. Suprahyoid pass from the infrahyoid to the suprahyoid group, and it gives us the possibilities for the best understanding of these triangles. If we provide the imaginary vertical line, middle line, of course, from the mental protuberance till the jugular notch, we can realize that the anterior portion of the neck form two quadrangles. Superior border of this quadrangle is formed by the base of the mandible, inferior portion by the clavicle, and the posteriorly by trapezius muscle, and anteriorly by the imaginary middle line. It means that the right and the left quadrangles, and you are looking at the left side, at the left quadrangulum. It is divided into two regions: the anterior cervical region, which is located anteriorly than the sternocleidomastoid muscle, and the lateral or the posterior cervical region, which is behind than the sternocleidomastoid muscle. And position of the hyoid bone, the topography of the hyoid bone has great importance for understanding and the position of this bone explains the good opportunities for understanding the several triangles such as the submandibular Piragov's triangle. It can be palpable less or more, but the greater horns, the horn major or the greater horn, it is palpable than the body. Good palpable than it's well pronounced than the body of the hyoid bone, and it is located between the thyroid cartilage and the mandible. And again you are looking at the anterior view of the neck without sternocleidomastoid muscles. Why? Because I've explained the cervical fascia, but I have to repeat that the fascia of the cervical region has three layers, or easily think that it is divided into two layers: superficial one, which doesn't have the great clinical or theoretical importance. It's just located under the platysma, and the next moment the proper fascia of the neck, or the pretracheal layer. Pretracheal layer of the fascia is considered then like the proper fascia of the neck, and it has the superficial and the deep portions. Don't confuse it, please. We have the superficial cervical fascia, and also we have the superficial layer of pretracheal fascia. A pretracheal fascia is officially the proper fascia of the neck, and the deepest cervical fascia is the prevertebral layer, or if you want, the lamina prevertebralis, which pass inferiorly to the endothoracic fascia. In the pectoral cavity, it passes to the endothoracic fascia. And you are looking at the carotid sheath, which is formed by the cervical fascia. It consists of it is formed inside of this sheath. You can find the internal jugular vein, common carotid artery, and superiorly than the thyroid cartilage, the internal carotid artery, and vagus nerve. Here's the thyroid gland with the pyramidal lobe. I've noted that we can observe this lobe in 30-35% of the cases. For example, just It's this case. One is these cases, and you are looking at the brachial plexus, subclavian artery, and it is separated from the subclavian vein by the anterior scalene muscle, because the subclavian vein, it is located more superficially than the artery of the same name, and it is understandable because during our first lecture I explained you the common rules of location of the vessels and the nerve trunks in our body, and I noted then that the veins are located superficially than the arteries. Skin nerves of the cervical region, they are very important for providing some injections and for understanding of the perception of impulses, especially the touch, temperature, and other other kinds of the general perception, general reception. The skin nerves of the cervical region, especially the anterior region of the neck, they are branch of the cervical plexus. Cervical plexus is formed. The plexus cervicalis is formed by the first, second, third, and the fourth cervical nerves, of course, by their anterior or ventral branch, because the posterior branch of the spinal nerves, they don't form any plexuses except the first, the posterior spinal nerve, except the first and the upper first and the lower three nerves, the coccygeal and the last two sacral nerves. Other nerves are divided into the medial and the lateral branch for innervation of the skin of the trunk and the neck also. And the main skinny or the cutaneous branch of the cervical plexus are the nervus occipitalis minor, this one, nervus auricularis magnus, and the nervus transversus colli, this one is the transverse cervical nerve, and the nervi supraclavicularis. All of them are the branch of the cervical plexus. Please attention to the very close position of last three nerves, auricularis magnus, transverse colli, and the supraclavicularis. Erb's point in the clinical practice, or the neural practice, it's called like this point. And about the veins of the neck, the veins of this region, main collector of the cervical region, the main the greatest importance to the as the internal jugular vein. It begins from the sigmoid sinus, which is located. This sinus is located in the groove of the same name inside of the skull. And internal jugular vein has two kind of the roots, the intracranial and extracranial. Of course, in the neck region, we have to talk about the extracranial branch of the extracranial roots of the internal jugular vein, such as the facial vein, the veins of the from pharyngeal plexus, and internal jugular vein. You are looking at the way of this vein, and please attention to the anterior jugular vein. Two anterior jugular veins, they connect with each other and form the arcus, arch. This arch is located in the upper than the manubrium sterni, because the fascia of the neck inferiorly than the hyoid bone is divided into two plates, anterior and the posterior plates. These two plates are attached to the manubrium sterni. of course, the first plate, anterior plate, to the anterior surface of the sternum, the posterior plate to its posterior surface, and between them the spatium, space, suprasternal space is formed. In this space has the many fat tissue, of course the lymph nodes, and the anterior arch, or the venous arch, which connects to the both anterior jugular veins. And again, the veins of the cervical region, you are looking at the surface anatomy of the external jugular vein. External jugular vein, which is corresponded to the posterior branch of the external carotid artery. It drains the venous blood from the occipital and the posterior auricular regions. It passes more superficially than the internal jugular vein, and it receives the anterior jugular vein, which I have explained before. And external jugular vein, again, its way, it opens maybe independently into the venous angle, and the venous angle is formed constantly between the internal jugular vein and the subclavian vein. Maybe it opens into the internal jugular vein of the same side, between the platysma and sternocleidomastoid muscles, projection from the gonion to the midst of the clavicle. Posterior part of the cervical region, you are looking at the pharyngeal muscles, the superior, middle, and inferior constrictors of the muscle, and especially on the posterior wall of the pharynx, the pharyngeal plexus is good pronounced. And of course, the pharyngeal plexus, this venous plexus form the roots for internal jugular vein, or simply saying the branch from the pharyngeal plexus open into the internal jugular vein, and the position of the vagus nerve with the internal and inferior, the common carotid artery, and passing at the disc between the 6th and the 7th cervical vertebrae, the pharynx pass to the esophagus. Very important structures like the fascia-like structures around the sternocleidomastoid muscle. Here, the asterisks indicate the portion of the fascia medial to the platysma. Platysma was reflected inferiorly here. The fascia-like structures deep to the platysma was transversely sectioned in the B. The sectioned fascia was reflected inferiorly. Arrows here they point to the cutting edge along the medial border of the sternocleidomastoid muscle. Here SCM means the sternocleidomastoid, which demarcates a rough medial and a smooth lateral surface of fascia. The sternocleidomastoid muscle was cut and reflected inferiorly, as you know here. Again here. And the next moment, the fascia of the sternocleidomastoid muscle. Look at the A. A red and blue latex was injected into the right and the left sternocleidomastoid fascia respectively. The left SCM fascia was opened to reveal that the injected substance, injected latex, was limited within one head of the muscle, the asterix, by the intramuscular septa held by the forceps. And C explains the CSM was cut and reflected inferiorly. The arrow indicates the spread of the latex along the intramuscular septum. Light blue latex was injected into the fascia deep to SCM, and was limited to around the strap muscles or the deeper muscles of the neck. About the location of the fat pad in the cervical region, the fat pad is in between the skin and the platysma. Depending on the body mass index and sex, the subcutaneous tissue layer might contain quite a thick layer. This layer can be removed from the platysma underneath easily without removing the fascia of the platysma because there is a soft connective tissue located in between. The thickness of the fat pad regularly is in the submental region here, well developed here. And the section of the left neck region, the remark, the fat tissue underneath the fascia in the lateral cervical triangle and fascia cervicalis superficialis. The fascia is the superficial body fascia which continues either cranially into the fascia parotidomestheterica, because you have to know it can be way of the spreading of infection, or caudally into the fascia thoracica superficialis, which covers the greater pectoral muscle. This fascia is a strong and especially in the ventral part of the neck well developed tissue, whereas the fascia cannot be well dissected without damage in the lateral cervical triangle, posterior triangle. This section of deep plate of pretracheal fascia between the two omohyoid muscles and the blue probe here is positioned underneath the fascia in the pretracheal area. In this film you are looking at the carotid triangle with the main elements: the carotid triangle, the common carotid artery, its bifurcation at the level of the superior border of thyroid cartilage, the sternocleidomastoid muscle. Superior limit of this triangle is the digastric muscle, and in the lateral view you can look at the carotid triangle again. This triangle first is covered by the skin, then the superficial fascia platysma, and the cervical branch of the fascial nerve is here. Transverse cutaneous nerve, which I explained before, from the cervical plexus, and then we pass to the deeper layer. It's the topographic anatomy. It's important because it's the studying of the human body layers by layer. Middle constrictor of the pharynx, then the inferior constrictors of the pharynx, and the thyrohyoid membrane, which will be pierced by the branch of the superior thyroid artery, the arteria laryngeal superior, and by the branch of the vagus nerve, superior laryngeal nerve. Look at the common carotid artery and the position of the carotid sinus, enlargement of the common carotid artery, and the carotid body. This body, glomus, has the endocrine function and the way of the internal and external carotid arteries. Very easily can be separated here, but they are located very close to each other. Superior thyroid artery, the first branch of the external carotid, lingual and facial arteries. Facial is the 8 here, and the sinus branch of this artery, the ascending pharyngeal artery. About the veins, just I've explained before the way of the internal jugular vein and the common facial vein, which is formed by the facial, by connection of the facial and the retromandibular vein. Also the pharyngeal veins from the plexus of the same name are opened into this internal jugular vein and the lingual vein. The nerves of this region, the lateral cervical region, you are looking at the vagus nerve, the tense paired cranial nerve, its superior laryngeal branch, the external laryngeal nerve, it innervates just the cricothyroid muscle, And the internal branch, it pierces the membrane and enters into the laryngeal cavity for innervation of the mucous membrane of the laryngeal cavity, but just till the glottis, just till the glottic cleft, the voice cleft of the larynx. And about the lymph nodes of this region are divided into the superficial and the deep group. They are located mainly around the veins, because the deep group is called the internal jugular lymph nodes of the neck. And in these topographical sections, you are looking at the organs, the position here, the anterior, posterior part, the lumen, the opening of the esophagus, then the trachea, and the trachea, esophagus, between them the loose connective tissue with the recurrent laryngeal nerves from the vagus nerve, and the separate vagina for the vascular and the nervous structures of the neck, like the internal jugular vein, common carotid artery, and the vagus nerve. They together are located in the carotid sheath. Here the carotid sheath, right, left, the visceral plate of the cervical fascia for the organs, for the visceral organs of the neck region, like the larynx, like the trachea, of course the cervical part of the trachea. It's a esophagus for the cervical portion, for the thyroid gland, and so on. Look at the very good pronounce the muscles of this region, the cervical vertebra, with the spinous process, with the skin, prevertebral fascia. Prevertebral fascia, it's the deepest layer of the cervical fascia, and inferiorly it passes into the internal thoracic fascia. Again, these spaces, very important spaces, because the space anatomy, the anatomy of these spaces are very important. The spaces of the neck, they have the great correlation and the connection with the spaces of the face, and inferior they pass to the pectoral cavity or the chest cavity. Here the mediastinum, which I'll explain during our next lecture. It's a very important portion, because the infection or the purulent processes can easily pass from the neck inferiorly. They can pass into the spaces between the two lungs, around the heart, and they can make the very great and the dangerous processes in the mediastinal cavity. Pretracheal fascia, again, I have noted the pretracheal fascia is considered like the proper fascia of the neck. It's the trachea itself, and the esophagus, position of the esophagus, and of course the vertebra. Carotid sheath, the thyroid gland, which is located anteriorly, then the thyroid cartilage, and the infrahyoid muscles as the sternothyroid, which is very close to the thyroid cartilage, sternohyoid muscle, and the omohyoid muscle. Both omohyoids, they have the more lateral position. Carotid sheath, again, prevertebral fascia, it attached to the cervical vertebrae. The vagus nerve, the spinal cord, again, internal jugular vein, common carotid artery, again. And about the retropharyngeal space, it is located between the proper fascia of the neck and the posterior wall of the pharynx. Retropharyngeal space, it has the it is very rich with the loose connective tissue and the lymph nodes, and these lymph nodes are involved during the several purulent processes, inflammation of the paranasal sinuses, of the nasal part, of the pharynx, of the infections or the other processes of the larynx. These nodes are they can be involved in these processes. And the visceral space, again, the visceral space, it is a space around the internal organs of this region, like the thyroid gland, the recurrent laryngeal nerve. Its position is very important because the recurrent laryngeal nerve, it arises from the vagus nerve, and it's the most posterior cervical part of the vagus nerve. I mean, the cervical part of the vagus nerve ends by arising of the recurrent laryngeal nerve, and you are looking at the paratracheal lymph nodes. The carotid space, again, carotid space with the internal jugular vein here. The common carotid artery, I want to explain common carotid artery till the thyroid cartilage. After the thyroid cartilage, it's the internal carotid artery and the vagus nerve. Vagus nerve is located here. Together, they are enclosed, and the cervical fascia, the special layer of the cervical fascia, forms the carotid shape for them. And internal structures, again, you are looking at the retropharyngeal space, and the section of the sternocleidomastoid muscle at the right side for good observation of the vascular structures of the lateral cervical portion. And the aortic arch, again, it explains the origination of the right and the left common carotid artery, but it's the posterior view. Please don't confuse that it's the right branch in your right side, right branch, first branch, the brachiocephalic trunk, which gives the origin for the right common carotid artery. It's the left common carotid artery. Of course, the left common carotid artery is longer than the right one. And the thyroid gland with the section on the middle point for good observation of the trachea. Again, the position of the fascia, which includes the infrahyoid muscles, I mean the proper fascia of the neck, and with the nervous structures of this region. About the scalenus muscles, scalenus anterior especially, it's the key muscle of root of neck. It's deeply placed and descends vertically from vertebral column to the first. Look at this muscle, and you can define this muscle by passing of the anterior surface of this muscle, the phrenic nerve, nervus phrenicus, pass on the anterior surface of this muscle. It inserts, it attaches to the first rib. Of course, it elevates the first rib laterally. It flexes and rotates the cervical part of the vertebral column, but it's very important. It's the anterior portion or the anterior wall of interscalene space and the posterior wall of the antiscalene space. This just limitation between the internal antiscalene space and the interscalene space is the anterior scalene muscle. And important relations of this muscle anteriorly, it's the carotid arteries, the vagus nerve, internal jugular vein, deep cervical lymph nodes, transverse cervical and the suprascapular arteries. Prevertebral layer of deep cervical fascia bend phrenic nerve to muscle. Posteriorly, it's the pleura, origin of the brachial plexus, second part of subclavian artery and the scalenus medius. Medially, the vertebral artery and vein and the sympathetic trunk. It's the medial neighbors of this muscle. Left side, it's the medial border is related to thoracic duct. Laterally, it's the cervical plexus, roots of the brachial plexus, and the third part of subclavian artery. You are looking again at the common carotid arteries, at the origination of the common carotid artery at the right side. It origins from the brachiocephalic trunk. At the left side, it origins from the aortic arch. The subclavian arteries on both sides arch upwards out of thorax to enter root of the neck. Right subclavian artery, look at again this picture. Right subclavian artery origins from the brachiocephalic trunk. Left one origins from the aortic arch, and both are located in the interscalenic space, the subclavian artery right and left one, with the brachial plexus. Right subclavian artery begins posterior to the sternoclavicular joint as one of two terminal branches of the brachiocephalic trunk. It arches superiorly and laterally to pass anterior to cervical pleura and posterior to anterior scalene muscle. Continuing laterally across the first rib, it becomes the axillary artery. Left subclavian artery begins in thorax as a direct branch of the aortic arch. Lying posterior to left common carotid artery and the lateral to trachea, it ascends and arches laterally, passing anterior to cervical pleural and posterior to anterior scalene muscle. Continuing laterally across the first rib, it becomes the axillary artery. Deep structures of the submandibular triangle, which are the occipital artery, arteria occipitalis. It's the branch of the external carotid artery. It's the posterior branch. The parotid gland, the facial artery, arteria facialis, lingual nerve, nervus lingualis, and the submandibular gland. Duct of the submandibular gland is here, and the profunda linguae, deep lingual artery, is here. 9 and the 18, 9, this one, and the 18 explains the hypoglossal nerve, which forms the superior border of the Piragov's triangle. This triangle, or it can be called as a triangle of the lingual artery. The roof of this triangle is formed by the hypoglossal nerve, and importance of this triangle is that during the bleeding from the lingual artery, we can ligate, we can close the lingual artery only in this triangle. The tongue itself, the pressure and the speed of the blood, arterious blood, is so high, and the doctor, the surgeon, can't stop the bleeding from the direct portion. Doctor must open this triangle and close the lingual artery here. Internal carotid artery is 14, and the lingual artery, the sympathetic trunk, truncus sympatheticus, and the nervus laryngeus superior is 17, which I have explained before. It is divided into two branches: external branch for innervation of the cricothyroid muscle, and the internal branch for innervation of the mucous membrane of the laryngeal cavity. The structures of the carotid triangle, which I have explained before, layer by layer, we explained it: the skin, then the superficial, of course, the skin, platysma, superficial layer of the pretracheal fascia, and then we get the very deeper structures of this region. Please, I want to direct your attention to the structures like the 11 is the omohyoid muscle it forms the border of the carotid triangle after crossing by the sternocleidomastoid muscle. The superior venter of this muscle form the border limitation of the carotid triangle, and the 15 explains the superficial veins of the neck. Neck region is very rich by the superficial veins. Again, the nervous structures of this region: internal jugular vein, the medially located the common, then the internal carotid artery, and the sternocleidomastoid muscle with definition of the anterior or medial triangle of the neck and the posterior or the lateral triangle of the neck. The lateral region of the neck, as you know, it is by the inferior belly of the omohyoid muscle is divided into the two triangles. Inferiorly located the omoclavicular and the superiorly located the omotrapezoid triangles. And here I want to explain that the truncus tibiocervicalis 11, it's the trunk, it's the branch of the subclavian artery. Subclavian artery gives this branch, and this branch also has the branch as arteria thyroidae inferior thyroid artery. It's very important for vascularization of the thyroid gland. And here on the thyroid gland, the two main arterial structures like the external carotid artery and subclavian artery together form the intersystemic anastomose. Intersystemic means the anastomose between the two different systems, two different vascular systems, arterial systems in this case. Trigonum omotracheale, which is very important for providing of the several operations on trachea, such as the tracheotomy, and it is bounded by the sternocleidomastoid muscle, superior belly of the omohyoid muscle, and by midline. Here's the looking at the omoclavicular and the omotrapezoid triangle. Topography of the larynx, which is very important for us. It has the several age features, sexual features, location of the pharynx in the neck, the anterior view in the adult male. When the head is upright and the larynx is centered in the neck, the hyoid bone is at the level of the third cervical vertebra. The superior border of the thyroid cartilage is at the C4. C4 means the fourth cervical vertebra level. The laryngotracheal junction is at the 6th cervical, 7th cervical level. These structures are located approximately 1/2 vertebra higher in women and in children. The upper part of the larynx is especially prominent in the male, forming the laryngeal prominence or the Adam's apple. General features of the larynx: the left anterior oblique view. The following cartilaginous structures such as the epiglottis is here, thyroid and the cricoid. These cartilages are connected to one another, and trachea and the hyoid bone by elastic ligaments which allow some degree of laryngeal motion during swallowing. The arytenoid cartilage and the corticulate cartilage are not visible in this view. Of course, they are located in the another side of the larynx, not in this picture. The vessels and the nerves of the larynx and thyroid gland, which I have explained before, you are looking again at the superior laryngeal nerve. The vessels of the same name, they together pierce the thyroid membrane and they pass into the larynx. It's the external branch which passes only to the cricothyroid muscle, no other muscles, just the superior laryngeal nerve innervates the cricothyroid muscle. Here this muscle is cut, and you are looking at the larynx from inside. Approach to the larynx and trachea. Approach of the cricotomy. Tomy, you know, the section, cutting. High tracheotomy and the low tracheotomy. Mid-sagittal section, left lateral view. When an acute edematous obstruction of the larynx, for example due to an allergic reaction, poses an acute risk of asphyxiation, the following surgical approaches are available for creating an emergency airway. Division of the median cricothyroid ligament, which is called the cricothyrotomy. Incision of the trachea, tracheotomy at the level just below the cricoid cartilage, high tracheotomy, and just superior to the jugular notch, which is known as the low tracheostomy. And you are looking at the anatomical relationship between the superior thyroid artery, and external branch of the superior laryngeal nerve. The inferior thyroid arteries are branch of the thyrocervical trunk arising from the subclavian artery, runs superomedially posterior to the carotid sheath. It's a main important topographic moment to reach the posterior aspect of the gland. Supply the posterior inferior aspect, including the inferior pulse of the gland. The right and left superior and inferior thyroid arteries form anastomosis within the gland. You are looking at the veins of the thyroid gland as a endocrine gland. The vascularization of the gland is very rich, and you are looking at the superior thyroid vein accompany the superior thyroid arteries. Middle thyroid vein do not accompany but run essentially parallel courses with the inferior thyroid arteries, and inferior thyroid veins, they accompany the thyroid artery. Of course, if this artery is presented, it's the fourth but the non-constant branch of the aortic arch. It takes place in vascularization of the thyroid gland, but you have to know when this artery is presented during the operation tracheotomy, the surgeon can damage this artery, and it increases the risk of life for patient. Lymph nodes of this region, as I have explained before, lymphatic drainage of the thyroid gland, presence of metastasis in lymphatic nodes of neck can be first sign of thyroid carcinoma. Thyroid lymphatic vessels communicate at the first level with the prelaryngeal, pretracheal, and the protracheal lymph nodes. The second level, superior deep cervical nodes from the prelaryngeal nodes, and inferior deep cervical nodes from the pretracheal and the protracheal nodes. Some lymphatic vessels may drain into the brachiocephalic lymph nodes or directly into the thoracic duct, which of course increases the risk of life. These are the references which I've used for preparing of this lecture. Thank you for attention.